Good morning, everybody. It's Bob here from WMUK, and today I'm delighted to be talking to Dr. Aisha Patel. And Aisha works as a fellow at UCLH under Shirley Dessar. Good morning, Aisha.
Good morning, Bob.
Good morning. Yeah, it was nice to have met you last week in London and have a little chat with you. But just wanted to talk to you today really about the Rory Morrison Registry and the PROM project that you oversee at UCLH. So let's start off with the Rory Morrison Registry. We've all heard about it, and we know that some hospitals send in data, but what is the registry and why is it important? First of all, to us as WMers, and more importantly, why is it important to clinicians?
Yeah, so just as an overview, the Rory Morrison Registry is an online database that essentially collects information about our patients with Waldenstrom's, but also with other IgM-related disorders. And those include things like cryoglobulinemia or cold agglutinin disease, so things that some people may have never heard of. This registry essentially collects data from all the hospitals that are involved with it. So at the moment, we have 20 hospitals across the UK that are involved with it. And they upload all the information. So from diagnosis and things like your bone marrow results, your blood test results, all the way through to treatment and your outcomes with treatment. So how successful that treatment has been, how long you've been on the treatment, etc. At the moment, we're also collecting data on quality of life for patients, which our patients complete themselves at home. So this is all sent through email. The importance of this, especially in Waldenstrom's, is that Waldenstrom's is such a rare disease, and there are only 400 patients diagnosed with Waldenstrom's each year. So these patients are scattered across the UK, and it's difficult to, I guess, with one center, get enough data from a group of patients to see what the trends of treatment are, the trends of diagnosis, etc. are. So this is a really important registry in that we can then get more information about diagnosis, what types of patients we tend to get, what ages they are, what ethnicity they're from, and then trends in treatment as well. So what types of treatment we're using now compared to maybe 10 years ago, what new treatments are doing. So new treatments such as ibrutinib, how our patients are responding to them, whether they're having any side effects from them, etc. And this is really important for clinicians as Waldenstrom's is just evolving so rapidly. And we have new treatments coming out constantly. We have quite a few clinical trials going on at UCLH. So to be able to see how these treatments affect patients and how we can tailor our treatment towards patients is extremely important and really affects patients who have been diagnosed previously and for new patients as well.
Okay, and how many do you know offhand how many of us WMers you've got on the registry at the moment?
Yeah, in total we have 1,160 patients. Okay. On the registry at the moment, and that includes patients who are just giving clinical data. So those are the hospitals that are uploading the data, and also patients who are involved with the quality of life project as well.
Okay. And so you mentioned, I think you said 20 hospitals, which on the scale of things isn't many from the number of hospitals there are scattered around the UK and the British Isles. So why is that? Why do some hospitals why aren't they signed up to it, as it were?
So I think when we first started this project, we specifically targeted hospitals which had the highest number of Waldenstrom's patients in them. I mean, some hospitals will not see any Waldenstrom's patients for years, and some hospitals such as UCLH will see many Waldenstrom's patients on a weekly basis. So what we have at the moment is we have the biggest centers involved, and then we're slowly expanding that to other centers. We have approached some hospitals who are unable to join, and that is either due to a lack of staff who can then take the time to upload the information. And that's usually the main reason why they cannot join, or they don't see enough Waldenstrom's patients for it to be a feasible project for them. But yeah, that's generally the reason.
So if I was to speak to my fellow WMers, perhaps advise them to ask their clinician, does my data go on the RMR? And if so, why not? And see if they can come up with an explanation. And would it simply be, just thinking forward, will it simply be a matter of maybe funding somebody to input that little amount of data? Because it's only every 3 months, I guess, isn't it, for each particular patient?
No, definitely. So actually, sorry, Bob, I didn't mean to cut you off.
No problem.
But from the registry, we do have a funding
Oh, okay.
for like an allotment for uploads to the registry. So centers can claim. The issue is more time. So if they have staff who have the time to upload to the registry. But we would definitely encourage all WM patients to approach their clinicians to see if they are contributing. And if they are interested in contributing, they can email the emails on the website. But they can email us with their interest, and then we can send them all the documents required.
Okay, good. Yeah. So that's the Rory Morrison Registry, and that really is tailored for the clinicians for their as they move forward in treatment plans and that. But you touched on quality of life there, which is for us really the WMers ourselves, and I think it's called PROM, patient recorded outcome. Is that right?
Yep, patient reported outcome measures.
And that's all about the quality of life. So and this is one thing I know you're particularly keen in, and we want to try and get everybody that we know about with WM to contribute to this, don't we?
Yes, please.
So just tell us a little bit about what that covers and what it entails for us.
So patient reported outcome measures essentially measures quality of life data. So this isn't things like blood tests or CT scans. These are the things that affect patients day to day. So for example, anxiety measures, depression scores, as well as symptoms such as nausea or vomiting, and then things like physical function. So how well people are walking, if they can carry their shopping, etc. So the importance of this is that when we do our clinical consultation, we don't have the time to be able to go through all of these different things in one clinical consultation. And if we gather this data on the database, then over time we can see what the trends are and what WM patients tend to suffer from, such as anxiety. If they suffer from anxiety more often, we can then screen for that during our clinical consultation and try and get a patient help earlier. So that's a big importance for us. The way that this affects patients, so the way that patients can get involved with it is that an email is sent to them every 3 months, and they just need to fill in 4 questionnaires. So it gives you a link that goes directly to the 4 questionnaires. You fill them out online, and then it automatically logs it into the database. It's pretty simple. I don't expect it would take more than 10 to 15 minutes to fill out. And that's how we do it. We've had a lot of interest from WM patients, and I've found that the Waldenstrom's group of patients are really great and very involved and very keen to get involved. So it would be fantastic to have more patients involved with this if possible.
Good. And do you know how many patients you've got, or WM patients you've got doing that at the moment?
I think we have about 140 patients, but we'll have more in the last couple of months, thanks to your push, Bob. So probably around 160, 170.
Okay, but there's room for a lot more, isn't there? I mean, the more of us that do it, the better it helps us, not just you guys, the clinicians, but it helps us as well. Yeah.
One thing to note is that if anybody's been previously filling out paper forms in clinic, if they can please let us know, so just email us, because clinics have become telephone clinics due to COVID, we can then switch you to an email PROMS questionnaire.
Yeah, in fact, that's what happened to me recently, wasn't it? When I first made contact with you earlier, I said, I thought I signed up for this like a year and a half ago, but I've never received a form, and you very kindly researched it for me, and it turned out I'd elected to fill my forms out in clinic, and then COVID came along and I never went to clinic. So now I'm on the email. So if anybody else out there who thinks they've signed up to PROMS but have never had this form to fill out, that may be the reason. So just contact the registry and on the email address on the site, and Aisha will switch you over to email. But I think it's really important message to all of you guys out there with WM is how important this survey is for us, perhaps more than for the clinicians, this patient recorded outcome measures, because it helps our clinicians, helps them to help us greatly. One little question though for you, Aisha, and it's a common theme nowadays, is data protection. So how do I know that by filling these forms out, you're not going to sell my data to the pharma companies?
So we will never sell personal data to pharma companies. It's always anonymized. So no names, date of births, or NHS numbers are going to anybody. if your data is given to a pharma company, it's not your personal data. It will just be the information regarding your diagnosis, treatment, etc. But nothing. There's no identifiable information in there.
So that's reassuring. Then it's totally, when we fill these out, we know that it's totally anonymous to anything that goes on to anybody else. Yeah, brilliant. Okay.
Yeah, exactly.
Well, thanks for that. I think the message to come out of this is twofold, really. One is to embrace the Rory Morrison Registry and try and, if we're in centres that aren't submitting the data, is to lobby our clinicians to try and get it sent into you so that you can gather that. But more importantly for us as WMers is to embrace the PROM project and get as much information into you as we can. So I'm going to push that again over the next few weeks. So thank you so much for that, Aisha. That's been really helpful. Now I understand you're not going to be at the RMR much longer because you're going off to school to become a hematologist. Is that right?
Yes. I started in August. Yes, I start my training to be a hematologist in August.
Well done. And hopefully you'll come back. How long's the training for that?
5 years.
5 years?
5 years.
Wow. Well, hopefully in 5 years' time, you'll be coming back as one of our WM specialists.
Yeah.
And,
there you go. You never know. Yeah.
And the guys in London can look forward to coming and seeing you about their condition.
Yes.
Yeah. So
that'd be great. Yeah.
Aisha, thank you so much for this morning. I really appreciate you giving up your time on a Thursday. Have you got pottery again tonight?
I do have pottery again tonight.
Good luck with that. Yeah.
Thank you. But thank you so much for having me. And thank you to all the WM patients who have been contributing to the Rory Morrison Registry. It's fantastic. And I think it will be so helpful for all of us in the future.
Okay, Aisha. Thank you so much indeed. Really appreciate it.
Thank you.
Bye-bye.
Take care. Bye. Bye.